I couldn't be fully present in responsibilities or even with my own patients and my own practice. So what it is, why it's important, bring in the evidence, the science, and the practices. Then, when we're confronted with a situation of suffering and...
Hello, Olivia. Thank you so much for being here with us for Chung Hung Institute podcast.
Well, thank you for having me here. So I'm no longer Assistant Dean of Resident Affairs, and nor am I any longer the co-director of a pediatrics program at the Montreal Children's Hospital. I left to focus on compassion practice, embodiment training, so that I could bring it back in a more informed fashion, in a more embodied practice fashion. And I felt that, how do you find the time to do all that? I couldn't be fully present in either responsibilities at the hospital, at the Faculty of Medicine, or even with my own patients and my own practice, and fully be present and integrate precious knowledge and practice into life for the benefit of others. I took time off to do this, working now to reintegrate, to bring back into the hospital, the Montreal Children's Hospital. I just wrote a proposal, actually, on offering an introductory session to the leaders of the hospital, clinical physician leaders and managers, just in bringing awareness to compassion, what it truly is. There's so many misconceptions about it. So what it is, why it's important, bring in the evidence, the science, and the practices. So within this session that I'm planning, and hopefully will be accepted, I plan to bring in a brief practice, which I have found to be very beneficial when I've done it for groups of physicians at the hospital or residents. It's a compassion practice. Basically, it's a just like me, expanding our compassion, at least to our group, the community within which we work. That I found has resonated so deeply with people who are just beginners with these concepts and practices. So slowly bring this in. Then with leaders, they will know what this is, and they will then support the spreading out, the expansion of this teaching to all people, physicians, nurses, allied health professionals, receptionists, anybody who works with patients, for the benefit of not only patients, and that is of prime importance, patients' safety, their quality of care, their healing, but also for the people, the physicians, the healthcare providers who are offering this care, sustain and strengthen their capacities to offer compassion, to connect with people, to heal.
You clearly seem passionate about compassion, Olivia. What is compassion?
Compassion, as I've learned, we all know explicitly what it is. I've learned through JIMPA and the CCT training and in readings that compassion is basically, at a fundamental level, it's the expression of that human fundamental basis of caring. The umbrella term is a sense of concern that we feel when we're confronted with a situation of suffering, and this is very necessary for definition of compassion, the intention and motivation to see that suffering relieved, which leads to an action component. And I always teach that it's wise action, because we cannot always physically do anything, fix anything, solve anything. We can listen, we can be present to, we can be present for, we can walk with, and we can also give space to people while letting them know that we are there for them if and when they need. So there's a lot of action that we can do, including with Tonglen practice, that we know the action in our minds, which primes us for action when appropriate and when possible.
It's a perfect example of deep passion and love for the work you do.
And then there's the CCT, the multidimensional process with the different components, which I think I've kind of covered with that. I don't need to be so conceptual, because the course itself, when people take the course, will learn the different components. But I think that understanding of just the general umbrella.
Olivia, you mentioned wise compassion. Now, the other side of wisdom is ignorance. Tell us the difference. What's wise compassion versus ignorant compassion? And how do we avoid falling into the trap of ignorance?
I think awareness is key. Resonance, truly listening to not what is only said, but what is also not said. In truly understanding the situation, we can then practice wise compassion rather than the ignorant compassion of not truly understanding the situation. And often that ignorant compassion is fueled by our own wish to diminish our suffering in the empathic resonance with the suffering that we see, the suffering of others. So I may want to do something quickly to diminish the unpleasant emotions that I feel. However, that is then not wise action. If I truly understand the situation and am alert and aware to my own suffering in resonating with the other person or person's emotions, then I can be with my own, attend to my suffering or empathic or vicarious suffering, and clearly understand or listen for what they need.
I wonder, like at the medical center, a lot of nurses, I've heard, at least here in the United States and some other countries, that they say that they have compassion fatigue. But I've heard Thupten Jinpa say that there's no such thing as compassion fatigue, it's empathy fatigue. So can you tell us about that?
That is such an important concept to name as a misnomer. So compassion fatigue it's a misnomer. And we can say that with more clarity since the neuroimaging studies have helped us understand that when people have empathy for others in a situation of suffering, and most of the studies were done on patients of witnessed pain, people witnessing pain. So when we witness pain and feel the empathy, the empathic resonance of that pain, certain areas in our brains light up, and those are activated. Those are areas associated with pain and unpleasant emotions. And the studies, they taught people who were novice meditators, people didn't know about compassion or how to elicit it. They taught them in a very brief practice of eliciting compassion, generating compassion. When they did the studies on people generating compassion as they were witnessing suffering, they noticed that different areas of the brain were activated. And these were areas that were associated with positive emotion, reward centers, so love, affiliation, prosociality, care. The centers for empathy were active, but less so, were tempered and buffered. So the conclusions from these studies were that if we remain in empathy, then all these negative emotions continue to exhaust us. We feel these negative emotions, and over time, if we don't have the tools to address this vicarious suffering, then we can become fatigued from being emotionally exhausted. However, if we can learn how to generate compassion, then it can buffer those negative emotions and activate reward centers and positive emotions. So the question then is, how can we become fatigued from all these positive emotions? And likely, we cannot. It's more the empathy fatigue rather than compassion fatigue. One might add that we can become fatigued, physically fatigued, if we're continually being acting our compassion towards others without caring and attending to our own needs and suffering. That's what can lead to emotional exhaustion and burnout.
What exactly would you say empathy is? A lot of people these days are saying empathy is not a good thing. But I think empathy is a really amazing aspect of the human.
Empathy is, first of all, it's that immediate resonance, emotional resonance with emotions of others. and it can be with resonance with negative emotions. It can happen with positive emotions. So empathy is something that I've learned. Of course, humans have, primates, non-human primates also have, and even other mammals, which I won't get into because I'm not so informed. But so empathy is a good thing. There's a separate cognitive empathy. So the emotional resonance and cognitive empathy, which I've learned through Tanya Singer's writings, it's more termed mentalizing, and it doesn't activate the same pathways in the brains. But that cognitive empathy is understanding the situation of another and understanding that they are suffering in that situation. Even though I may not suffer in that situation, I can accept and honor that they are. And that can lead me to the concern and the motivation to relieve the suffering. So empathy is very important in our, as part of the path, part of the process of awareness of suffering, which leads to compassion. It can be not so positive, in that if we remain in the empathy, it can be hurtful for ourselves or harmful in the sense that we just remain distressed. It's a vortex of static negative emotions. However, we can use empathy to generate compassion. And then there's a lot of studies I've learned on empathy where our empathy is modulated and can be influenced by our perceptions of situations, our social categorizations, our judging of what's deserved or not. So empathy is very complex and complicated.
Yeah, it sounds like empathy is the precursor for compassion, which is the precursor for genuine love, like unconditional love and regard for humanity, right? This common humanity. And I'm curious, Olivia, with that, how can people use these tools, the knowledge of empathy and compassion, to prevent burnout? Like, how can compassion training, compassion cultivation really assist people to be so present to their patients or to their students or to their family and friends? Talk about that.
I think first through understanding what compassion is and addressing those misconceptions, understanding why it's so important, i.e. the benefits for others, the studied benefits. So when people understand that there actually are studied benefits, measured outcomes that are beneficial to patients when we offer it, and when people receive it, and when we offer it, there are benefits. When people understand that and then feel it, actually experience the reward that oneself gets from offering it and seeing the benefits that others benefit from our compassion, all that adds to, adds to our wish to practice and offer. And again, I've lost sight of your question.
How is it people know this knowledge, people know about compassion, people begin to learn to practice compassion, although maybe some people think that it's already in them, so why should they practice, right? But then they still burn out. So how do the practices actually prevent burnout for people?
I think first, when we practice, and it doesn't have to be sitting formal practices, it can be the informal practices as well, if people don't have time or it doesn't resonate with them. But doing these practices over time connects us to people more and more deeply, connects us to ourselves. So when we are more connected to people, patients, colleagues, burnout, and when we can feel and experience the reward of these connections, we are less likely to burn out when we're less emotionally exhausted. So the definition of burnout as the emotional exhaustion and the cynicism and depersonalization, and there's another feeling of being ineffective. So when we practice compassion, we are less emotionally exhausted. We're in fact we feel a positive emotions. We depersonalize less. We see people as the human beings they are, rather than the diseases and the tasks that we have to perform. We see them as people. And then we feel more effective. And when we see them heal, so that addressing those, just being compassion, helps us, without even intending to address burnout, it does. And studies have shown that physicians, practicing physicians, students, residents who have higher levels of compassion have lower levels of burnout. So that's one thing. And also, practicing compassion helps us be more aware of suffering. That's part of the first step, actually, that enhancing our awareness, specifically of suffering in the context of compassion. So when we are more aware of course, the others' suffering, then we will attend to that. But when we're aware of our own suffering as physicians, there are so many aspects, the grief of patient adverse events and deaths, the emotional exhaustion from having performed errors. And we're human. Everybody's human. Errors occur. We don't want them to, and we try to prevent them. We do our best not to. But when they do, they do. So that causes a lot of suffering, emotionally resonating with the suffering of patients and colleagues causes suffering. So there's many aspects of suffering. And when we practice compassion, we become more aware of our own suffering, and then we can attend to that. And so there's that other aspect of healing ourselves in order to heal others, and as we heal others. I don't know if I got all the question.
Yeah, I love that, Olivia. And I'm curious if you can talk about common humanity within that. What's common humanity?
Common humanity, as I've learned from Jinpa, is the notion that we human beings are all the same at that very, very deep, deep human level of our aspiration for happiness and to not suffer. And as much as we're different in our experiences, our narratives, our perceived identities, if we leave those layers off, take those layers off, take away the narratives of ourselves, go deep down, we are all the same. And we are all as well connected in the sense that we rely on so many others, and we don't even know we rely on people whom we rely on and what we rely on, what for we rely on, but we are connected in every way. So common humanity is that sense that we are all together in this, and we are all the same at that basic human level.
How can people apply that nowadays when there are so many disagreements throughout the world, where there are so many divisions and a lot of anger?
If people can remember that notion and take off all the layers, remember that this person in front of us is a human being just like me. And I find that practice, that just like me practice, is so helpful, taking the layers off and remembering that this person also suffers as me, as I do, also has ups and downs, also has been disrespected, has had love in their lives, is a child to someone, and maybe a good friend to someone, feels lonely. So, all those layers of people's experiences, if we can remember that they have them just as I do, then it might connect us more to each other.
How did that change your life, Olivia? Like before you learned about compassion, you were Olivia A, and then now you learned about compassion. Let's call it Olivia B. What are the changes? What are the transformations you've experienced?
It was very gradual. I was one of those people who had misconceptions. I could not use the word compassion. I couldn't use the word loving kindness, even suffering. I remember telling a group of, we're in mindful practice, that I didn't suffer. I get through. I don't suffer. I deal with things, I get through them, and that's it. And I move on. And over time, with the learnings, the practices, I recognized that actually that wasn't so. That yes, I did suffer, like everyone else. And in my mind, I was strong. I didn't suffer. I was there to help everybody. And I see the suffering, which I do, and I do aspire to help others and intend to and motivate. But in helping, healing myself and recognizing, I can so much more deeply sense or see the suffering of others and wisely see what I can do, even not physically, to help. And the practice has helped me connect to people at that deeper level of the just like me common humanity, where I may walk. In the past, I walk on the streets, and if there were people asking for money, or people unhoused, very difficult situations, I would see a person who was unhoused, who was asking for something. Now I see the suffering, I connect to it, I see all people as human beings who, just like me, who doesn't want to suffer, who
People who want to help but feel helpless these days. They feel like they cannot help others,
Yeah.
in tragedy.
There's always a way. When we cannot, in one instance, I've learned that we can practice the helping in our minds through Tonglen, through the wish, this inhaling, the breathing in, taking on the suffering of others, and breathing out, giving our compassion. And even though we may not be able to help then and there, perhaps we can prime ourselves to help when we can, if we can. And if we cannot help in that one situation that we are distressed about and focusing on, we may find a way to help in another situation. And I do believe there are ripple effects. We may not immediately help that situation we're focused on, but helping in another situation may expand and plant seeds throughout with ripple effects everywhere to eventually help, maybe not in this time, but help perhaps the ripple effect of that situation. So I always see there is a way to help. Maybe not the way we want to or wish to, or is possible, or is appropriate, but we can.
Yeah, I like how you mentioned with Tonglen and like really bringing in the pain and transforming it right into this kind of healing light, rather than just like spreading the pain, right? Because it's so easy to be like, in psychology we have like we project, right? We would use the term projection, and so it's like it's easy to project. I'm angry, so I'm going to go project that anger to somebody else, or I experienced anger from someone, so I'm going to go pass it on. But that just perpetuates these generational wounds, I think.
Yeah. I guess it perpetuates when we're not aware of how we are experiencing that negative situation. Yeah. I found that even without Tonglen, when we are aware of what we're experiencing in relation to that negative situation, that anger, that conflict, that hatred even, then we can choose not to perpetuate But it takes work. It's simple in theory, but it takes work in
I feel like that's why everyone should learn psychology and contemplative pedagogy.
it,
Have some kind of practice.
it's so helpful. Yes. Yes. And I guess I find that we don't even have to teach it didactically. And if we just embody it and model it over time, these little snippets, I found that I've learned most from experiencing little bits, from noticing others who model things who are that way towards me. Those little bits, they may not explicitly change me, but over time they add and they build. And I reflect back on them and I reflect on, oh, that was so helpful. That felt so good. And then we become all those snippets of goodness. It gathers in us.
I love that you say the experience, right? Because it's so easy to go around talking, but to walk that talk is very rare. Yes. Olivia, so we have a ritual here with Chung Hung Institute. And that ritual is where the previous podcast guest asks a question to the next one, in this case, you. So your question is from Dr. Lewis Hoffman. Dr. Lewis Hoffman, he is an executive director here in Colorado, specifically in Colorado Springs, of a psychology association, so Rocky Mountain Humanistic Counseling and Psychology Association. So he's curious, how do we advocate for compassion in systems that have been historically connected with systems that participated in oppression and marginalization of certain groups or people?
How do we advocate for compassion?
In these systems that historically participated in oppression, marginalization of certain groups of people?
I think that's a great question, by the way. And, I actually learned a lot through reading a book. And I can answer that question because this book helped me understand the experience and then that precious outlook that the author had. And the book is termed My Grandmother's Hands, I believe.
I remember that book. Yeah, I read that.
And the author was, it was a descendant of the enslaved populations in the US. And he was writing about how there was no anger in his writing. There was only an understanding of the groups that had perpetuated the oppressions. Understanding and in understanding with kindness and compassion, and then through solutions. And so, in my mind, how do we advocate for compassion in groups who have historically repressed, oppressed, is first to understand where that oppression, where the source of the need to oppress or the wish to oppress comes from, and then to address with kindness, with patience, with compassion, the source, be it the anger, the fear, the historical trauma, their own, and I think it starts from there without even mention of the impact and the actions, if you may, and of their groups, of that group. So addressing that first, and then bringing on the experiences of the oppressed peoples, groups, And I know some sources have advocated for meeting together, but I think that would be later to understand each other as human beings. So first, addressing the trauma of the oppressors, then having them understand the impact on the, I don't want to use the term victims, but the people receiving the oppression, and then eventually bringing together so they see each other as common humans.
If Resma Meniken was here, how do you think she would address the fact that these people who are participating in providing oppression or marginalizing others, how do you think she would answer that? How do you think she would stop or advocate? Maybe not stop, because that's a very broad question, but how do you think she would advocate to bring in these practices of compassion to such populations, the oppressor?
I would love to know, actually.
I wish we could interview her.
It's been a long time since I read the book. I just remembered that the overall impression I had from how do I think she would advocate for them. I think just going into groups, small groups within this large group of people who have systemically oppressed, and starting with whatever, listening first to the experiences and the backgrounds of these groups of people, listening for their needs and understanding why they have this outlook, this mindset. And it may be different for different people. We can't assume. And then addressing. So how would she do it? I really don't know, but I'm just imagining that one has to reach out. One can't teach and talk from the outside. One has to reach in, or not reach out, but reach in.
And what I hear you saying, Olivia, is one just needs to really embody that compassion. Because if you embody that compassion, then you get to know the mind of the other, and you get to really resonate with that. Right? This emotional resonance you mentioned earlier, empathy, where it all begins. And then from there, there's transformation because there's understanding.
Yeah, thank you for naming that. Yes, reaching in to understand empathically. And if we don't have that emotional empathy, we can use the understanding, the cognitive, to connect. And then over time, we may emotionally connect as well. Yeah.
So simply said, but difficult to do. But hopefully all of us can try and practice, train, transform. Olivia, if people want to find you, how can they do so?
I'm actually not easy to find. I guess I am on LinkedIn. People can message me. I've been meaning to set up a website, but I just don't know how. But anyway, I do have an email, olivia@compassionmeded.org. And yeah, I guess those are the easiest ways.
Okay. Thank you. Thank you so much for being here with us, Olivia. I really appreciate your time. And I have a feeling a lot of people will benefit from the work that you're doing and from the work of compassion training in general as well.
Thank you, Sukhandra. It was a lovely conversation.